Good afternoon, everyone. Thank you so much for joining today. I think everyone's signed in and ready, so we are going to get started. Thank you so much for coming to this presentation on the top 10 poultry diseases to get to know for the small, mixed, or large animal practitioner. My name is Dr. Caitlin Macy, and I'm the District 9 Field Veterinarian with BOA. And I am also leading the state's Veterinary Medical Reserve Corps, which is kind of sponsoring this webinar series this year. So today our presenter is Dr. Geoffrey Lossie. Dr. Lossie is a graduate of the Purdue University College of Veterinary Medicine, and he then completed a combined master's and residency program in avian diagnostic medicine at Purdue. His training focused on diseases and conditions affecting both poultry and pet birds, and he is a diplomat of the American College of Poultry Veterinarians. After his residency, he worked for a small broiler chicken company and then taught at the Ohio State College of Vet Med before accepting his current position at Purdue. Dr. Losse works at the Indiana Animal Disease Diagnostic Lab as an avian diagnostician and assistant clinical professor in the Purdue College of Vet Med Department of Comparative Pathobiology. So just want to give you all a couple of housekeeping items before Dr. Losse takes us off. First, if anyone is at your site, if there are multiple people watching wherever you're watching from, please email us to let us know the names of each person so that we get everyone appropriate CE credit. And also, we will have a Q&A session at the end of Dr. Losse's talk. So currently you are muted. If you can think of any questions, please feel free to type them into the chat box, and we will try to address as many questions as we can at the end. You can either direct them to BOA or everyone in the chat section, and we will go ahead and address all of them at the end. So with that, go ahead and take it away, Dr. Losse. Thank you.
All right, very good. Thank you so much for that lovely introduction. I'm very happy to be here today with all of you. Hopefully this is going to be informational for you guys. This is going to be essentially a crash course in the top 10 diseases to know for you guys if you decide to branch out and see poultry as patients. And I highly recommend that you do. One of the things that I hear over and over, and I'm sure you guys have gotten calls at your clinics, do you see poultry? Do you see poultry? I can't find a vet that sees poultry. And so one of my goals with having vet students out with me on our rotations is to get them more comfortable in poultry. You don't have to be a poultry expert to help out your poultry clients. I can guarantee you that. So with no further ado, let's get right into today. And I want to talk off just for a couple, just one slide here on when are you going to get a call, or when do I get a call? And there's some pretty common ailments or reasons that clients will call you about their poultry. One of the most obvious being is random death losses. So a lot of times clients will come out, they'll find one dead bird in their small flock of 5, 6, 20, and that's very new to them. A lot of times, clients are used to, eventually their dog or their cat passing away or a horse. But for whatever reason, when people seem to get chickens, they're always stupefied when their chickens die. And sometimes it's a normal process, and sometimes it is disease related. So oftentimes the first call you'll get will be for death loss within a flock. Respiratory signs. This is one of the other common ailments or common clinical signs that birds are, that I get called or birds get submitted to the diagnostic lab. Lameness and paralysis, particularly revolving around MAREK'S disease. And we'll talk about that here. That's actually going to be our disease number 1. Sometimes they might note diarrhea or bloody stools, but what I will tell you is that a lot of clients have absolutely no idea what their chicken stools look like. Even though one of the things chickens love to do is to defecate, clients oftentimes don't spend enough time looking at it. Drop or ceasing of egg production is another common reason. and weight loss or failure to grow. That is going to be specifically more towards your clients that are probably raising meat birds, so either chickens or turkeys in general. Now, what are you going to need if you want to start seeing poultry and doing some basic diagnostics? I would recommend that everybody perform necropsies, but I'm a little bit biased being a diagnostician. So having some good necropsy shears or poultry shears is an absolute must. Roll pack bags or disposable baggies to collect tissue samples. If you are going to be out in the field, I imagine you already have these in your truck or your vehicle, but I highly recommend you have sterile culturettes. So those are always useful for sampling, particularly for back T. One of the best things about diagnostics these days is we have PCR. And for PCR, it's highly recommended that you use a polyester tip, so a synthetic tip, so not cotton, and a plastic handled swab, so not a wood handled swab. Sometimes some of the chemicals that are used in creating that or preserving that cotton or that wood have been shown to cause errors in the PCR when you go to run it. So you should always, if you're collecting swabs for PCR, you should always be using a polyester tipped or synthetic tipped plastic handled swab. Formalin jars, of course, being another staple of any veterinarian's toolkit. Blood collection supplies, there's nothing special that you need here. Oftentimes 3cc syringe for a standard size chicken, get 2 to 3 mils of blood for a standard size chicken. I usually recommend just using an inch long 23 gauge needle and going from there. And if you have any questions, because they're a little bit out of the scope of this presentation, but there are some nuances with blood collection in poultry. If you ever have any questions, I'll have my contact. It was at the beginning of the slide, and we'll have it at the end of the slide as well. And then minimal PPE. If you are going to be seeing routine, multiple poultry clients a day, or you are going to be driving out to people's premises, highly recommend at a minimum that you have some biosuits, so a Tyvek type biosuit, some disposable boot covers, bouffant, so hairnet type deal, unless your Tyvek already has the hood attached to it, and of course, always wear disposable gloves. And last but not least is Lysol or similar disinfectant spray. Every time we leave a poultry premise, the first thing that I do before I even get in the car is spray off the bottoms of my shoes. So having that Lysol, that disinfectant spray, that's going to help keep your other clients safe and make sure that you're not bringing any transmissible diseases from client to client. All right, so another thing that I want to mention, because if you are doing farm calls, it can be a little bit daunting to just walk out there and analyze somebody's coop setup and try to keep your thoughts in order. So what I like to teach students is the FLAWS method, or folks that aren't used to examining poultry and how they're being kept, and that's the FLAWS method. The F in FLAWS stands for feed. So looking at the feed, is it the right formulation for the age, for the species? Do they have enough of it? Is it at an adequate height? Are they storing it appropriately? There's a lot to look at, but just think of feed. So if you get out there, you're overwhelmed, you're like, oh man, what should I look at first? Think FLAWS, and the first one is F for feed. Next is L. That stands for lighting and litter. For most of your backyard coops, they're probably going to be naturally lit, so there's not a whole ton to think about there. Litter is very important, and we'll talk about why litter is so important when we get to pododermatitis or bumblefoot later on in this presentation. A is for air quality. That can incorporate anything from temperature to humidity, excessive dust levels, ammonia. That can be very important. Again, luckily with most backyard coops, they're naturally ventilated, so air quality generally isn't a major issue. W for water. You would be surprised, especially now that we're getting into the winter months, how many clients don't have the water warmers. So those bases that keep the water source for the chickens from freezing over. So making sure that birds have adequate water. The waters are clean, they're not frozen. Super important. You can't have hydrated birds if you have frozen water. And the S is for sanitation and biosecurity. So does that client have any biosecurity in place? In my experience, the answer is typically no. But some owners are great, and they have boots for plastic boot covers for visitors. They don't let other people with birds come on their premises or see their birds. So evaluating their biosecurity and how well they're keeping everything clean. So remember flaws if you get stumped during a flock visit. All right, the first disease that we are going to talk about. And if you take away nothing else from this presentation, please take away some of this information on MAREK'S disease, because it will be one of the most common things that you see if you start or are already seeing poultry as patients. So what is MAREK'S disease? Well, first off, it's like I mentioned, it's one of the most common conditions in small backyard flocks. Clinical MAREK'S disease affects chickens, also quail and turkeys, but for all practical intents and purposes, just remember this is a disease of chickens. This is non-zoonotic. That is important to note. I have a lot of clients asking, can I get this for my chickens? Can MAREK'S disease affect my dog or my cat or my other animals? The answer is no. Again, disease of chickens. What is MAREK'S? It's a herpes virus that induces a T-cell lymphoma. So it is an oncogenic herpes virus. So this is almost ubiquitous in commercial poultry. However, in commercial poultry, every single bird is pretty much vaccinated for MAREK'S disease. And I will tell you right now that that is not the case for our backyard clients. It is very common, but I would not give it a ubiquitous title in backyard flocks. If it were truly ubiquitous, everybody had it, our lab would be swamped constantly with backyard birds being submitted with MAREK'S. We get quite a few, but we're not swamped yet. So this is a highly contagious infection that spreads very quickly. And one thing that I will tell you is that if you diagnose a client's bird with MAREK'S, the rest of their birds have MAREK'S. So if you diagnose it in even one bird, everybody has it. Now, the troubling thing with MAREK'S, and what a lot of clients find hard to understand, is just because they might have had 1 or 2 birds die from MAREK'S, that does not necessarily mean that everybody else in the flock is going to eventually die from MAREK'S. It can be very hit or miss in terms of how many birds in a given flock end up having MAREK'S disease transform into the oncogenic form, essentially, that can cause tumors and cause issues. So this virus is also a pain because it is very difficult to eliminate from the environment. And so if you have a client, you diagnose them with MAREK'S, they need to basically consider that their premise is always going to be infected with MAREK'S. It can live for years in the environment because the virus is shed in feather follicle epithelium, so it gets shed in the bird's dander. So if you think of a coop and you think about how dusty birds are, it is almost impossible to get rid of this from the environment. So once you diagnose it, they should consider that flock or that premise contaminated and infected with MAREK'S. There luckily is only horizontal spread, so there is no vertical transmission. So there's no true hen to chick transmission with MAREK'S. If you have to remember a single number from this presentation, the numbers to remember is 2 to 7 months of age. That is the most common time frame in which you will have clinical signs from MAREK'S disease. And almost every one of the cases that we get here at the diagnostic lab that is MAREK'S falls nicely within that 2 to 7 month time frame. Morbidity equals mortality. If it is truly MAREK'S disease that is causing the clinical signs that you are noted or have noted in a bird or the owner has noted, that bird will eventually succumb to MAREK'S disease. There is no other way around that. Morbidity, once you start seeing clinical signs, will build gradually and might persist for 4 to 10 weeks. But again, there's no guarantee exactly how many birds are going to end up developing clinical MAREK'S disease, or just there's no way to know how many will develop clinical MAREK'S, because there's a high level in variation in development of clinical signs, again, if ever. So what are these clinical signs? We keep talking about MAREK'S, so what are the classic signs? Lameness, paresis, and paralysis, and it's typically unilateral. So unilateral paresis, paralysis, that is what you are going to see. That is by far the most common presentation of Marek's disease. They call that a fencing posture because one leg of the bird is forward and one leg is facing backwards, like somebody going to fence. So they call that a fencing posture. Now, one of the things that you might still probably remember from vet school when you were studying for NAVLE is ocular Marek's. So due to tumor infiltration of the iris, you can get a pronounced color change, and we'll have some pictures coming up. That is pathognomonic. If you see gray to blue iris with a raggedy, irregular pupil, there is nothing else that will cause that except for Marek's disease. However, I will tell you, unfortunately, in terms as a diagnostician, it'd be nice if every single bird had ocular Marek's, but it is a pretty rare manifestation. Another one is crop distension. This is due to neoplastic cells infiltrating the vagus nerve. So that vagus nerve being responsible or being needed for appropriate peristalsis, so moving food down the esophagus into the crop and then out of the crop. If you have damage to that vagus nerve, you have impairment of peristalsis and you can get a big, giant dilated crop. Again, more pictures coming up, I promise. And then finally, we have weight loss and cachexia. In these young birds, it's common that they will just waste away. So they might be eating fine, acting fine, but they are just thin as a rail. And so cachexia can also be a common finding. So this is kind of a traditional, this bird was submitted to us here at the diagnostic lab. This is kind of, this particular bird doesn't have the one leg backwards, but you can see one leg is kind of underneath it and the other leg is extended forward. This bird did have Marek's. So this is a pretty common presentation with Marek's disease. Now, visceral tumors. So the tumors with Marek's disease can go to a number of different organs, probably the most common being the liver, the spleen, the kidneys, the lungs, and of course, the heart, and of course the nerves. So what you are looking at right here, the head is oriented at the top right of this image. These are the liver lobes here that you're looking at. And here you can see these nice discrete white masses. And that's the great thing about Marek's. When it is in its discrete nodular form, it looks like a lymphoma in almost any other animal. It's a discrete, round, firm, white-colored neoplasia. This is the spleen that you're seeing here. So this is the proventriculus right here. If you can see my cursor here, the spleen should roughly be 1/3 the length of this proventriculus. And you can see this spleen is markedly dilated. So it's diffusely dilated, but it also has kind of these more discrete tan foci throughout it as well. So this was that same bird that had this liver here. These are kidneys. So in birds, they have a cranial, middle, and caudal lobe to each kidney. And you can see here that each of these kidney lobes is diffusely enlarged and extending past kind of the normal area where you would, the normal level. So the kidney should it actually sits within a bony fossa of the pelvic girdle. And so it should normally be kind of flat with the pelvic girdle. But here you can see that kidney is markedly rounded up. And so that is a markedly enlarged kidney. This is what I was referring to with the pendulous crop. So the top differential for a pendulous crop outside of Marek's disease is either a crop impaction or what a lot of clients refer to as sour crop, which is a dysbiosis where you can get overgrowth of pathogenic bacteria or fungi within the crop, and it prevents proper emptying of that crop. But so if you ever see this, don't get pigeonholed and think, oh, it's probably just a crop impaction. It ate a bunch of grass or it ate a foreign body. If it's in that 2 to 7 month time frame, you need to have Marek's as a possible differential. So here are some eyes. This is that classic ocular manifestation, just checking the time. This is that classic ocular manifestation of Marek's disease. So here on the left, we have a normal eye. You can see irises. The iris color in most birds is a copper to red goldish color. Now, there are breed variations, so you do need, and hopefully if you're examining a flock of birds, you can look at some of the other normal birds and see what color their irises are, because there are some that have kind of a naturally almost brown to blackish iris, but most of your birds are going to have this nice copper-colored iris. Here on the right, that is an eye that is affected with MAREK'S. So you can see that very striking blue-gray color, and you can see that that pupil kind of has almost this jagged, irregular edge to it. If you see that, you already have your diagnosis. It's MAREK'S disease. Here, when we talk about involvement of the sciatic nerve causing that unilateral lameness, this is why. So here on the right, what I want to point out first is the normal sciatic plexus. So this is a great image because it shows the unilateral nature. So here on the right side of the image, you can see a normal sciatic plexus with those four kind of uniform nerve fibers coming off the spinal cord. And then look at the image here on the left. There's marked thickening to this nerve. But what I want you to note is look how the peripheral nerve is pretty much normal. So when you are collecting histopath samples, let's say you post a bird and you think it's MAREK'S and you're fine posting the bird and sending off histo samples to us here at the lab, you need to send that sciatic plexus as well. Because if you just collected this peripheral sciatic nerve, and let's say there were no tumors in this particular bird, you might miss it and miss your diagnosis. And so you actually have to kind of dig out that middle lobe of the kidney to visualize this sciatic plexus. So just to show you here, the sciatic plexus kind of sits right about here, kind of in between the middle and the caudal lobe of each kidney lobe. And so you can either remove that kidney just with blunt dissection. A lot of times, if I've already taken a kidney sample and I think it looks fine otherwise, I'll just squish out the kidney material, to be honest with you, so I can visualize that sciatic plexus and not damage it by cutting through it with scissors. So diagnosis and treatment. Histopath is by far the best way to diagnose MAREK'S. A lot of clients will want to say, well, I don't want to euthanize my chickens, so how can you diagnose MAREK'S on my birds that are alive? The problem is that you can have MAREK'S disease, and there are PCR tests that you can do on buffy coat of blood. We don't do that here. That's done at Texas A&M. But all that tells you is if MAREK'S virus is present. And just because MAREK'S virus is present, it doesn't mean that that bird died from MAREK'S disease. So the best way is to actually show those neoplastic cells in the various tissues. So I would like, if you're posting this bird and you're going to submit it, the peripheral sciatic nerves, the sciatic plexus, the brachial plexus, the vagus nerve, and any tumors. There is no treatment for MAREK'S disease. The best thing that your clients can do is buy vaccinated chicks. It is very difficult for clients to vaccinate their own birds. I won't get into why in the interest of time, but you can purchase vaccinated chicks. So use an online hatchery that always vaccinates all of their chicks, or on checkout on those online hatcheries, they might have to select vaccinate my chicks for MAREK'S as a separate item. But so make sure you talk to your clients about getting vaccinated chicks. All right, the next big one that we're going to jump to is MYCOPLASMA GALLISEPTICUM. So MYCOPLASMA GALLISEPTICUM is a bacteria. It's commonly referred to as MG, and I will probably call it that in the interest of not having to say that whole name every time. MG affects a wide range of poultry that are commonly kept in backyard or small flock or small commercial scenarios. Anything from chickens to turkeys to quail to ducks to pigeons, they can all get mycoplasma. Now, this is a small primitive bacteria that lacks a cell wall. It affects all ages of birds, which is important. There is no cure. MAREK'S disease and MG are by far the biggest pains for clients to have if they get into their backyard flock, because no matter how many antibiotics you throw at it, no matter what you do, you will never clear the infection from those birds. And so when I talk with clients and I diagnose them with MAREK'S, with MG, there's really only three options. They can either live with it knowing that they'll probably have relapses in their birds. They might have to periodically treat with antibiotics to prevent the birds from dying. They can depopulate their flock and start over with using all-in, all-out growing practices, meaning that they get all of their birds at one time, preferably as chicks from one source, and they never get any new birds until all of that flock is gone. That is the best way to keep disease out of a backyard flock. Or the last option, which is not very popular, is they can vaccinate. And getting a little bit ahead of myself in terms of the slides, but the vaccine that's available to backyard clients is a killed injectable vaccine. And it prevents clinical signs and reduces shed. But again, it never will prevent, or it won't prevent new birds from getting infected, and it will not 100% prevent shed. So it's great in that it helps reduce clinical signs if they want to keep those birds that they know are infected. But again, it can kind of mask clinical, or can mask MG in that flock. So because birds are carriers for life once they're infected, hot periods of high stress, so cold snaps, lots of rain, adding new birds, anything that can induce stress will cause a recurrence of clinical signs. And the other reason this is a scourge of many backyard owners is that this is vertically shed, truly vertically shed. And so if you have a client whose breeder, or let's say she's breeding a rare, or they are breeding a rare heritage breed, and they're selling those hatching eggs, or they're selling chicks, and they get diagnosed with mycoplasma, they really need to consider no longer selling. And a lot of clients, I'll tell you, in my experience, if they have those rare heritage birds that, maybe 2 birds a pair cost $1,000 or $2,000 for some of the breeders that they have, and they can sell each chick for a couple $100, they're probably not going to want to depopulate their MG positive flock. Now, the other thing that I'll tell you is that it is very, very common in backyard flocks, especially in exhibition birds, because they're going to shows constantly. They're getting exposed to other birds while they're at these shows. If there's a big biosecurity thing that I would recommend the client never do, to be honest, it would probably be to take your birds to a show. Wild birds can also be vectors for mycoplasma, specifically the house finch. So what are some clinical signs here? And then let's look at some good gross pictures. So swelling of the infraorbital sinuses. I'm not sure if you guys can see my camera, but birds have a soft sinus that sits right underneath their eyes that's not encased in bone. And so when you have mycoplasma as well as other respiratory pathogens, that sinus can blow up and get super swollen. So swelling of that infraorbital sinus, increased ocular and nasal discharge, sneezing, and what I like to just refer to as respiratory noises. One thing that I'll tell you guys, if you are working up a flock with a true respiratory disease, and somebody brings you a chicken and puts it in the exam room and you walk in, chances are you will hear the respiratory noises before you ever even get close to that thing with the stethoscope. You're going to hear crackling in the lung or in the chest when it breathes in and out. You'll hear gurgling in the trachea, or you'll see them kind of coughing up mucus, shaking their head back and forth. You'll see the ocular and nasal discharge. That tells you you're dealing with a respiratory infection. And unfortunately, with respiratory infections in poultry, almost all of the clinical signs are the same. There is no great way to say, oh, well, there's this little sign and that little sign. It's definitely this respiratory pathogen. Respiratory pathogens, the clinical scope of the clinical disease is very, very similar from disease to disease. MG usually ends up being a whole flock issue. You might not have every bird showing clinical signs in a flock, but trust me, if you have MG in a flock and you have poor biosecurity, or the owner is moving between pens to pens with no changing the footwear, sanitizing of hands, or changing of clothes, which again, most people, I fully realize, aren't doing that, it's going to infect the whole flock. The reason this is such a devastating disease in the commercial world is in laying hens, it causes, or in any bird that is laying, it can cause a marked drop in egg production. So again, because of the similar signs or clinical signs between respiratory diseases and poultry, you really need a definitive diagnosis before you start talking to that client. So here we have a picture of a bird. This guy came in during my residency. You can see he is puffed up. His neck's kind of scrunched in. So you can see all of this swelling in the periocular tissue. So there's marked periocular swelling. This bird is open mouth breathing. And if you actually look at the hackle feathers, the feathers on the neck, you can see they almost kind of look matted. That's from ocular and nasal discharge. And once this bird was euthanized, took another picture, you can see there's a crusting around the eyes. Those eyes are crusted shut. There's mucopurulent discharge coming out of the nares, and there's periocular feather loss. So treatment and prevention: purchase birds from an MG clean source. Practice those all-in, all-out growing practices. Again, having a client get all their birds from one person or one source, preferably as chicks, and keeping all of those birds up until they are ready to get either depopulate, or all their birds have died of natural causes and they're ready to get a new flock. Do not, I highly caution you, talk to your clients. Recommend that they never, ever, ever buy birds from a sale barn or an auction. I have had so many clients say, oh, hey, they had these great birds at the sale barn, bought a couple home, and now their entire flock is infected with MG. And in some instances, that requires depopulation. So never, ever, or always, I should say, from your aspect, always tell your clients never to go to a sale barn or an auction to get their birds. Antibiotics can help treat clinical signs and reduce mortality. Now, of course, anytime we talk about poultry, I don't think we'll get to it, so I'll talk about it now. You have to think, chickens are food-producing animals. You need, so there are certain medications that are just banned in poultry. Big one, Baytril. Do not script Baytril, please. So do not script Baytril for any chicken. I don't care if the owner tells you this is the most pet chicken you've ever seen. It lives in its own mansion. It's never going to be eaten, or its eggs will never be eaten. It doesn't matter. You cannot use Baytril. Another big one is metronidazole. But with these being food-producing animals, a lot of antimicrobials or different medications are either strictly enforced in terms of how they're used, or they are banned. And so what I recommend, and I have a slide at the very end, but I'll mention it now in case we don't get to it, is submit a FARAD extra label drug use request. So FARAD is the Food Animal Drug Residue Avoidance Database. I think I probably messed up one word in there, but that is FARAD. And so what you can do is you can pick, so let's say you want to use oxytetracycline. Oxytet, unfortunately, does have a label on it saying do not use in hens producing eggs for human consumption. But the great thing about FARAD or any antibiotic or medication you want to use, you do a request, you put in the size of the weight of the bird, how you plan on giving the dose, oral, injectable, etc., the dose that you plan on giving, the frequency and duration. Send that request via their website, and usually within 24 hours, they will give you a recommended egg and meat withdrawal time for that medication. So if you ever have a question on whether it is legal or illegal to use a certain medication, please reach out to me. Please submit a FARAD request and protect your license. So vaccination, already mentioned that. It's a killed bacterin, helps prevent clinical signs, reduce shed, but will not eliminate infection. Now, one thing to tell a client if they do want to go the vaccination route is this vaccine, if the birds are in production, will cause them to, will cause a drop in egg production. All right. The next big one that we have is coccidiosis. So this is number 3. So coccidia, I'm sure many of you are familiar with coccidiosis and the species that you work with, either whether it be dogs or cats, or cows. Birds have their own coccidia too. This is the most expensive poultry disease in the United States when we talk about commercial poultry. This is ubiquitous. If you have chickens, they will have coccidiosis to some degree. There's no way to prevent and 100% keep birds clear of coccidiosis. In terms of clinical signs, by far the most common is diarrhea, which is often blood tinged. So if you have a client and they say, hey, my bird's feces are looking kind of orange or maybe a little red tinged, you need to be thinking hemorrhagic diarrhea or bloody diarrhea, and coccidiosis should be your number one differential. Just as a side note, these are all in the genus Eimeria. These are species specific. So if you have a client that owns chickens and turkeys, they have a major outbreak of coccidiosis in their chickens, the coccidia species that affect chickens do not affect turkeys, and vice versa. Turkey coccidia only affects turkeys, chicken coccidia only affects chickens. Traditional or simple fecal oral transmission. Infection in a bird that has an intact immune system and is not being overwhelmed by high numbers of oocysts in the environment will simply fight off that infection and will never have an issue. Important to note that outbreaks are rare in birds under 3 weeks of age. This is a side note, but the oocysts do actually have to sit in the environment for a few days to sporulate before they become infected. Coccidiosis this is the season. This is the season for coccidiosis right now. And it's common in cooler, wetter weather. The moisture or moisture content of the soil has a big impact on the rate at which it sporulates in the soil, but also what happens when it gets wet and it gets cold. People that have chickens that are normally out on pasture, all of a sudden they're all shut up in a coop. And if they do not have adequate space in that coop, or they have poor litter management, you might have way too high a concentration of birds in that coop. And so if you put, let's say you stuff 20 birds worth or 20 birds into a coop that's only designed for 10, even if they're each only secreting a small number of oocysts just normally, when you get that many birds into a crowded space, you kind of get this multiplication effect. And so the more oocysts you start throwing into the environment, the more as those birds go through and they feed and they eat feces as they're picking around, you start getting a ramp up of the oocysts, and then you can have a major coccidiosis outbreak. So winter, so kind of fall going into winter and spring are the peak kind of seasons for coccidiosis. So again, stocking density is vital to preventing coccidiosis. Here's just a nice little diagram. Not going to spend a bunch of time on this because the treatment, regardless of the species of coccidia that you're dealing with, is almost always the same. Interestingly, though, each species of coccidia, here's some examples here showing on this image, does infect a specific spot within the gastrointestinal tract. For example, Eimeria acerugulina affects the upper third of the small intestines, whereas Eimeria tenella, which is probably going to be the biggest challenge for backyard owners in terms of what's going to cause mortality or death in their birds, the most pathogenic species in chickens is this right here, Eimeria tenella, and that affects the cecum. So what do you do, or what do you do for your clients when they have chicken flock or turkeys or whatever species it is that has a clinical coccidiosis outbreak? Get a diagnosis first. I know you'll probably have clients calling in saying, hey doc, I've got birds with diarrhea. I know it's cocci. What was that dose again? Can you tell me the dose? I'm just going to go ahead and dose. Even though the treatment for coccidiosis, most of they're actually over the counter, you don't need a script. I still recommend that they at least send you some fecal samples so you can be sure that it is coccidiosis and you're not dealing with something else. The treatment of choice is Amprolium, or the trade name or the product name is Amprol. It's made by Huvepharma. This is the poultry labeled product and is always preferred. I will tell you, just as a side note for you guys to know, that Chlorid, the cattle branded product, is the exact same formulation, the exact same product, but obviously it's not labeled for chickens. So if you can get the Amprol, the poultry labeled product, you should. If you have to use Chlorid, you should submit a FARAD request. I would think that it would be a 0-day withdrawal time as well, because it's the exact same active ingredient. But again, you're using that product extra label because it's labeled for cattle, not poultry. Usually depending on the severity of the outbreak, one treatment can be effective between 5 to 7, treatments should last between 5 to 7 days. You may need 2 treatments. Now, this is usually a powder or a liquid that gets added to the drinking water. The clients need to make that up fresh every single day. You can't just mix it up in a big jug and then just dole that out every day. You need to make it up fresh every day. Other things that they can do, they can bleach the surface, bleach surfaces, clean out, but you can actually even bleach the topsoil. That's only going to do a little bit. It'll kill off some of those coccidiosis that are right on the very surface. But then what you do is you rototill the soil. So you bring that fresh, that fresh soil that's not contaminated with oocysts from beneath up above, and you bury the infective oocysts down further into the soil. So that can also help in an outbreak. But the biggest thing is that prevention is key. So making sure that they have the right stocking densities for their coop and for their run. And I always recommend that clients feed a medicated chick starter feed for the first 5 weeks of life. Now, if Amprol does not work, because resistance with coccidiosis is a thing, so coccidia can be resistant to some of these products. The next one that does also have a label for coccidiosis for chickens is sulfadimethoxine. The only reason I wouldn't recommend this right off the bat is that, and sulfadimethoxine is not as bad as other sulfa drugs, but some sulfa drugs, especially if they are given at too high of concentration, let's say the owner screws up adding this medication to the water, it can lead to toxicity in laying hens. See how we're doing on time here. All right, unfortunately, I think this is probably going to be the last one for today, but we will talk about pododermatitis. So this is called bumblefoot. This is one of the most common management-related conditions that you will find in poultry. This is typically caused by staph species or strep as well. E. coli can also be thrown in there. The pathogenesis is simple. Essentially, you have heavy-bodied birds or even non-heavy, just regular birds. They have a small puncture or laceration or wound to the bottom of the feet, and you get environmental bacteria setting up and causing an infection. And birds do not produce liquid pus like mammals do. So think of a nasty cat bite abscess on a cat, how it's just a lot of really liquid pus. With birds, they produce very, very hard caseous material. It's not even true pus because they don't have neutrophils. But because they produce these hard caseous masses kind of right underneath the skin where that wound or where that item penetrated or caused a wound on the bottom of their feet. And so it can be, so right under the surface, you have this big caseated mass, and that's very painful for these birds to walk on. So improper bedding is one of the more common reasons. I always recommend pine shavings. For the coop, for bedding, pine shavings should be your #1 recommendation. Things like wood chips or even straw, those can have really sharp edges on them and can cause open wounds on the bottom of the feet, which can then go on to get those environmental bacteria contaminating those wounds. Large breed birds or large heavy-bodied birds are much more prone to developing pododermatitis. With waterfowl, so any of your ducks, geese, swans, some people keep, those guys are heavily predisposed to developing pododermatitis. Excessively wet litter, so think of trench foot and soldiers back in Vietnam. So when their feet were constantly wet, you get that secondary bacterial infection easily penetrating that normal, nice, healthy skin barrier. So excessively wet litter can cause pododermatitis. Inappropriate or improper perch design. A lot of your clients will use 2x4s. 2x4s are not an ideal perch type. It puts too much pressure on the feet so right at those corners, it causes too much pressure. And that pressure can cause hyperkeratosis, bacteria can get trapped in there, and you can get pododermatitis. The best perches, in my opinion, are natural sticks. Just have somebody go out to a local forest preserve, Even if you look like a crazy person collecting sticks, that's all right. Just collect some sticks and use those as your natural perches. Lack of exfoliation can also be an issue. One of the great ways that we have found to help with this is wrapping AstroTurf on the perches. That actually helps clean and exfoliate the bottom of the feet as well. And then hazards within the environment. I can't tell you the number of times I've been walking through somebody's pasture and there's broken glass, there's metal wire, little strips of metal wire, anything that can poke the bottom of a bird's foot can lead to pododermatitis. So this is actually, the next image is a better example, but this is one manifestation of pododermatitis. So you have this swelling, interdigital swelling here. So again, this, if you cut into that, it would be this big caseated kind of mass within that swelling. This is severe chronic pododermatitis in a very heavy duck. And so the normal foot pad has essentially been replaced with this granulation tissue that just has this hyperkeratotic, it's stained black, just crust to it. And so this is some really severe pododermatitis. In this particular bird, one of the dangers with pododermatitis is because birds have a renal portal circulation, so the blood actually coming from their feet goes through their kidneys before it gets to the heart. And so if you have open wounds on the bottom of the feet due to pododermatitis, it can be very easy for these birds to become septic. So this bird was septic and actually developed vegetative endocarditis because of these wounds on the bottom of the feet. This here is your classic pododermatitis, usually on that metatarsal foot pad. So the foot pad that's right in the center of that foot, you'll see this kind of little black proliferative nodule. And as gross as it might seem, because sometimes that's not like human things or human analogies, think of it as a nasty kind of whitehead, just a big, firm whitehead. So if you pried out that core, it would leave a big cavitation in the bottom of that foot, which is why I don't really recommend that clients, you can actually just squeeze those out. Depending on the severity. But I don't recommend that clients just do that. A, it's probably painful. I'd rather see you guys do it under a local anesthetic or get those cores out with general soaking of the feet in Epsom salts, which is one of the, that's the most conservative treatment for pododermatitis. And of course, you can go all the way up to doing line blocks, surgically debriding these wounds. And sometimes if it's severe enough, you might even have to do some reconstructive kind of skin surgery on the bottom of the foot. Just really depends on how adventurous you want to get and what the client is willing to pay for. So treatment, by far, the best thing that you can do is not get it in the first place. So having your clients, so if they bring you a bird, even if it's for a healthy exam and the bird doesn't have pododermatitis, take the time to talk to them, take 5 minutes and tell them about pododermatitis. They need to be checking the bottoms of their bird's feet on a regular basis, probably at least once a month, to look for these developing lesions, because once they find them and they're not severe, they can hopefully change or alter their husbandry practices that are leading to the pododermatitis and prevent further issues. Once you do have some lesions with pododermatitis, to draw out that core, essentially you can soak 2 to 3 times a day in Epsom salts. The easiest way that I've recommended clients do this is buy like a 15-gallon, big tote, like you'd put your Christmas decorations in and then throw them in the attic every year. One of those big totes, fill it up with a few inches of water, mix up your Epsom salts in there, cut a small hole in the lid so the bird has plenty of air, put the bird in, lock the lid down. Now it's forced to sit in that tub and soak its feet for 10 minutes, and the client doesn't have to stay in there holding the bird in a pot or something like that, soaking its feet. So if you can soak for 10 minutes a day or 10 minutes of treatment for 2 to 3 treatments, that's the most conservative approach. Once that bumble or that core comes out and you have that open defect in that bottom foot pad, they need to put some triple antibiotic ointment, a thin layer, and they need to bandage that foot. Because if that is open and now that bird's running around in pasture and mud and feces and all, you're just going to have it get reinfected. So keep that bird dry and clean during treatment. The main thing, checking time, prevention is key. Appropriately rough surfaces, make sure to exfoliate those feet. Surgical treatment, again, may be required for extreme cases. Please don't call me for surgical advice on chicken feet. That is not my area of expertise. And antibiotics. A lot of clients are like, well, should we start them on an antibiotic? My general recommendation is, unless it is severe, you've taken radiographs and you can maybe see evidence, radiologic evidence of osteomyelitis, or the foot is worn to the touch and it's hyperemic, it's red. And only in those instances would I recommend antibiotics. Otherwise, that caseated material, that's going to prevent pretty much any type of oral or injectable antibiotic from making it to the source. So only if it is clearly infected and that infection is spreading to the toes or going further up the hock or up the legs, the shanks, would I recommend an antibiotic. Mention that. And at this point, I am happy to take some questions, or we can keep going, kind of depending on what folks would like.
Dr. Losse, thank you. This is awesome information. I think if anyone needs to hop off because we are headed up to the top of the hour, that's totally fine. But we would love if you wouldn't mind continuing through all 10. And then anybody who wants to stay on, feel free to stay on. And
all right. Well, we're going to start the extra fast blitz round then. So we're gonna start blitzing, but I did want to spend more time on those because those are the most common things that you will see. And if you can master just those first 4 pretty much, and then some of these other ones like mites and lice, those are easy to diagnose, easy to get the hang of, really easy to help clients with. But if you can master, some of the background knowledge for some of those first 4, you're going to be more than qualified to help a lot of clients with chickens. So just want to get that out. And so speaking of mites, the northern fowl mite. This is the most common mite that you will find in backyard birds. And these are blood-sucking mites. So these guys can be quite an issue. And if the infestation is severe enough, they can cause anemia. They can cause unthriftiness because the birds are just constantly itchy, they're irritating, and they may be anemic. So poultry lice are feather and skin chewers. So unlike lice, and I believe if I'm remembering correctly from vet school, like lice and pigs are oftentimes blood-sucking lice, lice in poultry are chewing lice, not sucking lice. But mites in poultry are blood feeders. These guys generally live their entire life cycle on the bird, but can survive for long periods off of the bird. If you have them in a flock, chances are everyone's going to have some, but oftentimes you'll find that 1 or 2 birds will have them worse than everybody else. This is your classic northern fowl mite. The best places to look for these mites are right around the vent, so the opening to the cloaca. At the tail head, so where the tail feathers meet the body, so kind of right there at the preening gland, that is a great place to look. Under the feathers or on the back of under the wings, and on the back of the neck. Those are other good areas, but by the best places to look around the vent. And what you'll see is kind of this greasy, flaky, black-like tissue. Because these guys are blood feeders, imagine flea dirt feces, just much, much smaller. So imagine flea dirt, but very, very small. And you can see these mites with the naked eye. Or if you, even if you have glasses, doesn't matter. Or if you have some loops, you can put some loops on, you'll be able to see these guys. They're about the size, if you've ever seen those red little environmental mites that like to crawl around on rocks and little walls and things like that. They're about that size. But this is characteristic. So all this black, exudate, greasy looking stuff that you're seeing here, that is all northern fowl mite dirt or feces. Here's a freshly laid egg, again, showing that these guys like to live around the vent. So when birds are in a nest box and they're laying eggs, they will contaminate the environment with these mites, which will then go and dump onto the next bird that enters that nest box. Prevention. Limit rodents. These guys can act as mechanical vectors. So if they're snuffling around, getting food out of the chicken coop or using the bedding from the coop as nesting materials, they can transmit it. Wild birds can transmit northern fowl mites. You can offer diatomaceous earth dust baths as a preventative. Diatomaceous earth is not a treatment. You will have clients tell you that diatomaceous earth can fix everything under the sun. I assure you that it cannot. There are some instances, though, where it's useful. In this case, prevention. So having a pan of diatomaceous earth within the coop is great. It helps prevent those mites from getting on the birds in the first place. Inspect all birds prior to purchasing or prior or during the quarantine period. So that's another major thing. All of your clients should be, if they do decide to get a new bird and bring it home, it should be quarantined for at least 30 days, as far away from every other bird on that premise as possible. And when you do when that client does their chores for the day with the birds, they need to service the healthy established flock first,